Hi, I'm Dr. Lucy Meier from Third Coast Foot and Ankle, and I am going to discuss with you if what's on your foot is a wart. Now, warts are kind of a little bit of a mysterious thing for a lot of people. Nobody wants to admit that they have them, but unfortunately they can be very common and they can hurt. So what a wart is a virus that's actually infected inside of our skin that causes a bump. And most of the time when we're seeing them on the foot, it's on the bottom, but we can see them on the top also. Now, they can very commonly be mistaken for calluses because calluses are essentially just rough skin that feel like a bump. Now, how we distinguish between a callus and a wart can be tricky if you're not used to seeing them routinely, but there are some signs that can really distinguish them between each other. One is warts don't have skin lines. So when we look really closely at these lesions on our foot, a wart will almost look like a bubble sometimes, like the skin lines are disappearing or working around them. Also, warts sometimes, but not always, will have little dots in them. These are actually little blood vessels that the wart is forming around itself to help nourish it. And to our naked eye, it looks like black polka dots. They'll also bleed a little bit easier, so if you scratch it or scrape it and you notice it bleeds a lot, that can be another sign of a wart. Now, warts and calluses, like I said, can be very tricky to distinguish between the two of them. Very rarely do we ever have to biopsy them, but there are situations when we're treating somebody and they're not resolving the way we're expecting them to, and we will do biopsies to remove the wart. This is quite rare though. I have to say in a year's time, I see a lot of warts on a daily basis, and I have biopsied less than a handful of these types of lesions. So very rarely is it something more serious, but if it's uncomfortable and it's spreading, it's definitely something that we need to address and take care of. Now, the last thing that a wart is often mistaken as is actually a foreign body. I would say 80% of people that come in thinking they have stepped on something and have something in their foot actually have a wart. So if you're in that situation where you have something on the bottom of your foot, you have no idea what it is, and you're thinking maybe it's a callus, maybe it's a wart, maybe I stepped on a piece of glass, please come into our office, let us evaluate it for you. We'll tell you what kind of treatment would be appropriate for you. There are different treatments for what we diagnose it with, and we do this every single day. So something that is very complex as you're staring at your foot in your bed is something very easy for us to unravel for you. So please like and comment on this video if you found it any way helpful, because that is extremely helpful to us, but more importantly, let us help you with that thing on your foot. Call us at Third Coast Foot and Ankle. I am Dr. Lucy Meier.